Welcome. Nice to be with you today to talk about rediscovering motivation. I'm eager to start to talk with you, so let's start with your New Year's resolutions and new beginnings. The Everyone makes New Year's resolutions, or quite a few people do. When you're a person with Parkinson's disease, new beginnings don't happen just every year. They happen every day, every week, every morning. And so that's true for care partners too. A New Year's resolution is a goal. And it's hard to keep New Year's resolutions. By the end of one year, 9% of people who have made resolutions have dropped their resolutions. So this brings us to the next slide, which is about achieving success in keeping your resolutions and your goals. The topics we're going to be addressing today include motivation and goal directed behavior, types of apathy related to Parkinson's disease, finding strengths within yourself to cope and reactivate motivation, biopsychosocial processes in motivation, and finding strengths outside of yourself to cope and reactivate your motivation. Our next slide brings us to processes of motivation. In this case, we're looking at Albert Bandura's highly influential model of motivation. It guides us in using problem focused coping, which is an adaptive means when you use wisely, you try wisely and rationally how to solve a problem when you have and how to get motivation to solve that problem. The major components of this model are self efficacy, outcome expectations, goals, and sociocultural factors. Self efficacy is the belief that one's actions can produce desired effects. So you ask yourself, how likely is it that my actions can successfully achieve what I desire? Outcome expectations are costs and benefits of goal directed behavior. Will the benefits of achieving my goal outweigh the costs? Goals are a planned, future oriented change in self or your situation. What are my most immediate and important goals? What behaviors and strategies will I use to achieve my goal? Now, sociocultural factors are goal achievement facilitators. They help you achieve your goals, or they are impediments. So you have to ask what facilitators and impediments or barriers will affect my goal achievement. The next slide introduces Sam and Fran. These were two participants in one of my studies who were in an interview. They're in their 70s and they're retired. Um, so Sam has activity problems. He is increasingly experiencing oversleeping in the morning, having a slowness in getting dressed, a reluctance to get out of the house, loss of strength and balance, safety issues related to desire to do heavy physical work. He also has activity strengths, actively contributes to home activities, experiences pleasure, self discipline. He's good at planning and he has social skills. He's heard about rock steady boxing, and he and his wife, Fran, who is his care partner, these are pseudonyms. Um, are really interested. They've heard it has a great reputation, and so Sam also so he's thinking about this. Sam does have high self efficacy. It comes out through all of their interviews. He says, I try to push myself. I'm proactive. And Fran agrees. He doesn't give up. So that's good. He also is good at making goals. So his long-term goal he's discussing with us is he wants to regain his strength and balance to do the yard work type of activities he's used to doing. And he also knows that it's good to do a short term goal, which many people don't do, and that's why they don't keep their resolutions. They make these big, big goals that they can't achieve easily. So his short term goal is to actually visit the Rock Steady boxing program in his area and try out some tasks to observe to see if it's good, a fit for him. So uh, he also has this strength that he knows how to write a short-term goal, and he's happy to do that. Our next slide shows how Sam's other motivational factors in Bandura's problem-solving model might contribute to his current goals. Sam has outcome expectations that are generally positive, but he has some doubts. These outcome expectations are that he does feel that it's really a benefit for him if he could. He believes the Rocksteady program could probably help him strengthen himself and improve his balance. But he's also a little afraid that it might be too hard for him and to box and to do the things that are required at Rocksteady boxing. Fran also worries a bit, and they confer with one another. I think this will help him, she says. And it is his idea to do this too. So she wants to protect his independence. I told him, I think this is something you ought to do, but I wouldn't push it if he didn't want to do it. Sam decides the potential benefits are definitely greater than the outweigh the potential costs of how much effort he'll have to do to get to rock steady boxing and do it. The social cultural factors, Sam and Fran discuss facilitators primarily. They really are very impressed with what they've heard about the program, and they are don't think very much or tell us very much about impediments that they expect. Now, the behavior he has to achieve his short-term goal of visiting the program, the night before that visit to the program, Sam conscientiously prepares to wake up because it's very hard for him to wake up on time to take his meds. And he actually achieves his short-term goal and is able to visit the program. So that takes us to our next slide. Now, now I've shown you the whole model of Bandura's concepts, how they link together. They all link together to achieve goals. And once you achieve a short-term goal, it actually affects your self-efficacy, your outcome expectations, and the other factors. It may affect your goal, your long-term goal. So it's an iterative repeating process of continually revising your self-efficacy. Once you achieve a little goal of visiting, then you feel more empowered to try the next goal. Now, the one of Sam's achievements or strengths is that he has good self-awareness. And in this model of problem-focused coping, it's helpful to understand how a person reacts to the goal achievement, whether they how they evaluate themselves. And Sam turns to that self-evaluative piece and discusses this with Fran. What he's saying to Fran and to our interviewers is that I'm optimistic now after doing the visit about Rocksteady boxing. It's going to help. Watching those people though punching the bag, doing steps like boxers do, I couldn't do that. People jumped on a platform. I tried that last night at home and I couldn't do it. So he was a little concerned, but he was optimistic and willing to jump in. And Fran reports to us that the gym owner told Sam that he would go at your own pace. You'll go at your own pace. You may not be able to do the jumping, but you'll be able to do other things. And so that really helped him to feel that he was going to try it out and that he would maybe try it for a week or a month or beyond. So that takes us to our next slide on what happens when you actually show up to participate in a thing in a program like Rock Steady Boxing. And what happens is social facilitations effects kick in. These are uh, automatic processes that happen in our brain when we're in a social situation. Being in the presence of others, especially co-actors, people doing similar things to what you're doing and working with you, increases endurance and speed in well-learned gross motor endurance and energetic activities like boxing, walking, dancing, talking even. Um, so fine motor precision activities, however, might suffer a little bit in the presence of others. If you feel evaluation anxiety that they're looking at you, you might be a little embarrassed or you're distracted before your skill is developed. So you have to be able to handle those kind of anti-facilitation effects. And then, but however, another facilitation effect is that people tend to match one another's motion and rhythm. It's called interpersonal synchrony. It's well studied, and automatic mimicry. Your brain does it for you. You don't even think about it. It's automatic. This helps development of skill. And if you think about it, and if you've ever been to Rock Steady Boxing, it's it's got a lot of rhythm involved. You can hear the boxers hitting their whatever you call these things. You can hear them hitting their punching the bag. Thank you. I got it. And it's a very strong stimulus, and it's usually also rock and roll is in the background, so there's music, so it's a highly activating environment to help people do one punch at a time and develop their skill. Our next slide shows how care partnering also involves the same processes we've been talking about, and this is for Fran and other care partners, but we're going to talk about Gladys this time. Fran or Gladys, who's a care partner of a man with Parkinson's disease, must balance their own motivational, goal directed behavior and their self management of their time and self management of their care of themselves with the balance of helping their spouse or their caring other care partner. And so this is a paper that we did with Sue Berger, looking at the qualitative narratives of care partners. And what came up was they were really interested in caregiving and beyond, changes in their roles and activities, and they understood there's more to life than caregiving. They also were very interested in talking about spontaneously to our interviewers strategies to support self and the spouse, self-management strategies to help me, the care partner, and caregiving strategies to help my partner. The other thing that was very present in what they were talking about was the emotional impact. They expressed the burden and the compassion they felt for their partner. Here's Gladys talking. It's just dealing with Parkinson's and trying to separate the spouse that I know and knew before Parkinson's to try to empathize with what he is going through. There's a fine line between doing things for him and standing back and saying he has to do this for himself. Sometimes when I do that, I feel guilty because it would be so much easier for me to get up and get him doing something, but I don't get him something, but I don't want him to be completely dependent. So caregivers seem to be very cognizant of the need for self-efficacy in the person with Parkinson's disease. And they also need to be able to have the time and the respite to be able to follow their own goals and um, restore and rest themselves. Now, I'm going to take you to our next slide, which is about apathy. Apathy is um, apathy in Parkinson's disease is described in this way. It's a reduction in self-generated, voluntary, purposeful, goal-directed activity due to dysfunction in basal ganglia to frontal lobe neurocircuitry networks. There are three major types that have been identified and suggested to be particularly related to Parkinson's disease. This is reduced internal drive, in which a person has difficulty initiating goal directed behavior. There's severe inertia. This is a severe apathy. The person does very little daily participation, requires external activation by stimuli and people, and direction from helpers because of a loss of internal activation. A second form that is less severe is executive function dysregulation. It's a difficulty with planning and organizing actions to complete goals, reduced leisure interests and social activities, and quickly giving up on a task, also requiring some help to be able to plan and organize actions. The third one is a deficiency in reward motivation. This is difficulty performing positive, rewarding outcome expectations for goal directed behavior. There's a reduced emotional response to emotional stimuli like upsetting news, humor, may not be as concerned about family, emotional concerns, or health of the family. So these are types of health conditions that um, require individualized medication and therapy protocol, and in addition to what we're going to be talking about in a minute. But there are many other types of health conditions that mimic or can create apathy. These include depression, which may, when you give depression medications, may resolve the apathy. Dementia also can create a severe apathy. Sleep disorders are related, and fatigue, and many more aspects. The treatment method you receive depends on the health team differentiating among all these different other comorbid conditions you may experience. This takes us to our next slide on the importance of tailoring our healthcare for apathy and motivation. So, what this means is forming a working alliance with your health providers. The more they know you as an individual, your health needs, your preferences, your lifestyle, the more they can tailor intervention specifically for you. If you are experiencing apathy, your neurologist might be able to determine if the apathy is due to Parkinson's biopathology or to other conditions such as what we just talked about: depression, fatigue, disability, um, so that the neurologist can tailor your medical intervention for your needs. Mental health and rehabilitation therapies help you plan feasible daily life goals and plans for achieving goals tailored to your specific biopsychosocial capacities and personal preferences. I discovered for number four, this point number four, recently a paper first authored by Noordegraaf, who is in the Netherlands Parkinson's group. She's a patient advocate and patient researcher and coined the term hopamine. Um, and this hopamine is very similar to Bandura's outcome expectations we described earlier. It's hope that your behaviors and goals will provide more benefit than it does costs. So, beyond placing your hope on dopamine therapy, create your own personalized dose of hopamine. I felt that that was an excellent uh, coined terminology. I highly recommend that you read this paper for learning how to create your own dose of hopamine. You can find a copy of it by typing the hopamine Noordegraaf into Google Scholar and tapping the iOS press link to the paper. Now let's talk about reactivating motivation from within. What we need to do is to find the just right challenge for you. Okay, that's the task. This is a term that we use in occupational therapy to mean that we've found a fit, a goal and behavior that you can do to achieve your goal, a just right fit for you. And it activates, to have a feasible goal activates your self-efficacy. It promotes positive outcome expectation, draws upon resources in your home and community, and provides meaningful participation in daily living. Now, I want you to know that individuals like Sam needed very little help in activating his motivation. He had a lot of skills that he was able to draw upon, and he had high self efficacy and positive outcome expectations. Some individuals, however, have low self efficacy for a variety of reasons and negative expectations for the outcomes. And these people need very carefully gradated goals, feasible goals, from very simple steps to build up their belief of self efficacy. They need more expert health professional, one on one, and group experiences to guide them toward achieving realistic goals. The next slide introduces us to a helpful occupational therapy model that we use to help achieve the just right challenge in the people that we work with. It's called the Person, Environment, and Occupation Model, or for short, the PEO model. In this model, we look at a person or several persons, like the person with Parkinson's and their care partner, because this is all joined together in activity. But we'll take the person with Parkinson's, for example, and we'll look to see how to optimize their strengths and minimize their limitations. We identify personal goals, interests, skills, what are their capacities that they have, and then we identify what environment are they going to be working in for a particular goal once we've selected a short-term goal. And we select and adapt the natural human built spaces, the objects, the tools, the socio-cultural resources for them to be able to perform the occupation or the activity that they would like to perform, their goal. Occupation is our word for activities of daily living, and it comes from the early 20th century of how to use our time in a purposeful and meaningful manner. So we help people choose feasible activities and revise those activities flexibly. We revise duration of the activity, intensity, complexity, skills, needs, and the skills needed. The next three slides explain how we use this model. The P is for person. What abilities and interests can I contribute to an activity? In this particular one, caregivers are reading or people are reading to another person. And the types of capacities that are activated are listening, imagining, reading. So one person might be best at listening and another person might be best at reading, but both are imagining from this particular activity. So we look at both persons' capacities to see how they can contribute to this activity. The next slide then shows how we deal with the environmental modifications. How can the environment or objects be selected to adapt an activity to make it safe and successful? And this activity is clearly swimming or being in water. And in this particular situation, we can make a very challenging situation where here's a on your, I think it's on your left side, that you see a father probably holding a child in a deep pool. And that father is putting the child in a situation that is complex and less safe, and probably won't let go of the child until the child is ready to swim on their own. In the middle picture, you see a gentleman using a device to hold him up in the water, and that device is helpful for doing so. And in the picture on the left, you see an adapted activity in which nobody's in a pool. There's a lot of water use though, so you could choose any of those for a goal to get in the water during a hot day. Our final slide in this series, this series, is as how we adapt occupations. Occupations can be modified and to be more complex, more or simpler, or can be a step in a process, and it has to be successful and satisfying. So this is what we do. Someone who can is a beautiful cake decorator. I can't do this, but do make a beautiful cake can have a very complex but wonderfully satisfying occupation of baking this cake. Someone who can't do that but can make a simpler muffin with icing for a birthday party can choose to do the muffin. Or someone who can't do that might want to do one of the steps in the baking process, like breaking an egg, which is pretty hard to do, or stirring something, or passing it along to other people to do. These slides show basic ways the PEO model can be put into effect. However, this model can also be used to guide complex processes and projects with multiple people. Let's move to our next slide. Um, so we've been talking about reactivating motivation by finding strength within, but you're already seeing we need strength without too. So you can't just rely on yourself. Humans survive and flourish because we are social and we are interdependent in addition to our independence. We join our talents to get things done that we alone could not do, such as this great optimism walk that some of the members of my research lab went on one year. Um, Now, let's go to the understanding more about biopsychosocial processes. This looks very complex, but it's pretty simple in conception. I drew this to show that we are biopsychosocial creatures. And what that means is we have many layers to our human life. In the most interior level of our body, in the biological part on the left side, there's a little human figure, and it shows the nervous system figure. And we have many circulatory and systems in our body that are operating at an automatic level. So I don't you don't need to look at this, but we have psychological attributes that are operating. We have psychological attributes related to our survival, self-awareness, more higher level efficacy. We also have social layers to our being related to otherness, attraction, rejection, belonging in a community. And finally, there's the more external, natural environment, human built, and social, cultural um, context. All of these are operating 24/7 and they move back and forth all at once. So, an activity has the possibility of achieving all of these types of um, achieving biopsychosocial health all at once. Now, go to the next slide to see how this works. Here's in this slide, dance for PD instructors are and choreographers from the Mark Morris group in Brooklyn teach students and people with Parkinson's and caregivers how to collaborate in creating group dances that perform in a Tufts workshop that we have yearly. There are no patients. There are only dancers. Dance is an occupation that anybody can do if they wish. Dance movements and music provide rhythmic and emotional stimuli for physical coordination and function, social facilitation, emotional joy, and community bonding. Our next slide shows another example. Um, this is one of our participants talking about visiting his grandson. My grandson is in his third year of little league, so I go to every of his practices plus his game. Our social life is a potent factor, fitness factor. Many of our participants talk about family life and friends and getting out. It gets us up, out and about, walking, talking, thinking, and so on. We flex our biopsychosocial muscles every time we perform healthy, goal directed behavior. Now, I want to give you just another tip from one of our participants. Here's what she says about how to perform high activity engagement. You've got to kind of balance it. Find some time for yourself and your family, and find some time for your occupation. Keep yourself busy. Get up and work every day. Get involved with the family. There's not enough time to sit there and feel sorry for yourself. This is a common reaction that people tell us about. The sad times come when you're sitting at home and alone and find kind of bored and you start thinking, poor me. If you keep yourself going, you don't have to have any of those times. And then important to us is this social facilitation. In social facilitation is the next slide. We need to understand that it is important to exchange mutual support among those in your social network, even if you have Parkinson's disease. And this enables you to have strong personal relationships, a sense of belonging and purpose. Reciprocity, which involves mutual exchange of support, is expected in human interaction across the globe. It is human to reciprocate. If you help me, I'll help you, and vice versa. When you do something or give me something, I try to reciprocate. It's a give and take process, and you can mix up the kind of support you give. You might go shopping and instrumental support for a person, and they'll thank you, and that's an emotional support. So there are many, many ways to reciprocate. And then I think I have a couple more minutes remaining. So I want to tell you about how another person who's strong in exchanging support. She tells our interviewers, my daughter comes and she helps me get dressed and we have breakfast and she takes me to church and I walk in with a walker, then leave again with her help. And the interviewer asks, do you do anything to try to keep up with your social obligations? And she says, I have two bridge groups. Each of them come to my house once a week. I have several friends who come every week for tea or coffee, and it works great. So she exchanges with other people too. receiving and giving. And I think this brings me to my last slide. The most important thing that I want you to go away with is, whether you have Parkinson's or not, is keep yourself involved in activities that you find enjoyable and motivating the best you can. Create new activities to enjoy and exchange your skills and enjoyments with those around you, and accept help from your healthcare givers, collaborate with them and with others in your environment. Now, I would like to finish up here and also move on to our question and answer session with Anushka.
Hi, Dr. Tickle-Degnen. That was wonderful information, and I'm so excited to dive into the audience's questions. Our first question from the audience is, I struggle with setting goals in the future because this is a progressive disease. Do you have any advice for me?
That's a very good question. It is a progressive disease, and the best way to do it is take it one step at a time. Again, I think focusing on immediate goals, trying to be more in the present and making your goal something that is feasible to you. You may need a health professional to help you decide what you could do. An important goal is to maintain what you are doing now as much as possible. And so I would suggest starting with a maintenance type of goal. And how would you maintain that? And then another goal would be to how would you maintain that, and what steps could you do to maintain your current level of function, your activities, and your social network. um, that would be what I would suggest.
Thank you. I think that's great advice about maintenance. And I think that kind of ties into our other question here, which is, how can I manage my apathy when I live alone and I don't have anyone to prompt me to stay active?
That also is an excellent question. We had participants in our studies who were alone. I would say the best thing you can do is tap into community programs. If you can't get out of your house, if that's a difficulty, I would first try to access your community elder services and have them. In our town, we have people who will do visitation with an individual, and that can be motivating in and of itself. The person doesn't need to be a professional, but sometimes they are a person who's training to become a nurse or an occupational therapist or a psychologist, who do these visitations to people who are living alone. And then you could definitely get connected. That's the first thing. Also talk to your healthcare provider and also the APDA, Information and Referral Center, for community programs and ones that are close to you and for which you might be able to get community transportation. That's the other thing is, if you can use a computer or if you can use your telephone, which sometimes is not possible, you might try to make a commitment to someone you like, that you have a telephone call or a visit once a month or once a week, and that gives you a social responsibility. You know the telephone call is coming up. It makes you activate to do something like that.
Thank you for mentioning the APDA Information and Referral resource. Absolutely. If people want to know how to access the resources that you mentioned, call your local APDA or call our national helpline. We're happy to help you. And, briefly you mentioned people who may have struggles with getting out of the home. And this is another question that we got. What are some like small daily enjoyable experiences you could suggest for someone with Parkinson's who is no longer able to travel and getting out of the home is difficult?
I I think that um, if again you have anybody in your network, what I want to suggest is always keep increasing your social network that is available to you, who you could ask again, maybe once a week, maybe a couple times a week to help you get out of the home. That would be very important to try to do. To just sit in your garden. It's hard in the winter time. It's always hard in the winter time for people with Parkinson's because of the difficulty of the weather and what that creates in the environment. The other piece is if it's difficult to get out of the home, do you have, you might be able to get services to adapt your home for better accessibility to the outside. A ramp can be something that your community can provide. It all depends on the community or your health insurance. Um, and also, you could always have contact universities or academic programs that are training health professionals. Many of them like to have a small job or even a free job to help. And many of our OT students go and work as aides, and they'll come and help people get out of the home and that sort of thing, using their skills, developing their skills.
What a wonderful experience. We have one more question, and the question that we have here is, what do you suggest for how to form your alliance or your relationship with health providers? I only see my movement disorder specialist twice a year.
Yes. Yeah, this is quite a problem. You can only see your specialists very infrequently. Um, it is important to have good relationships with all of your providers, your primary care provider, people you know you can call. Again, the APDA, um, to find out how to actually oh gosh, tell me again what the question is. I just lost
Really,
it.
how people can have a alliance with their healthcare providers and just
Oh,
how they can work
thank you. The
closely with
alliance.
healthcare
Yeah,
providers because
yes,
they don't see their specialists very
yeah,
often.
yeah. Um,
So I think it's really just feeling like they have the care team to
yes,
support
I
them.
think that's really important to think about what you need to develop for that alliance. And one thing that to develop is to make sure that you have chit chat. This has been found with your provider when you arrive for your um, when you arrive for your appointment. And this is just exchanging pleasantries. My tip is to always say something that you did that was enjoyable, because when you are with a provider, you talk about problems. And so people always enjoy talking about enjoyable topics. We've done some studies in which we find when a person with Parkinson's is asked to talk about an enjoyable event, they show less apathy, they show less hopelessness. They are more hopeful, as if they've taken a dosage of hopamine. Um, and if they are asked about problems, they start showing more apathy, more, which we all do, kind of, I'm not sure, lower self efficacy, more helplessness. So, really chit chat and help them to understand what your lifestyle is. In a very short time, you can do that. Oh, how was the Red Sox? Sorry, I'm from Boston. How did you think about that Red Sox game last night? or oh, the weather is terrible today, or the weather is looking up. It's if for enjoyable topic. Are you getting out to do anything? That is a very good first start. The other thing is to pay attention, and healthcare providers love it when someone follows through with a prescription or follows through with meeting a goal. They want to work with you if they know that you can do that.
Is all the time we have for questions, but really, on behalf of our audience and APDA, thank you so much for being here and for your thoughtful responses to our questions. We appreciate you very much.
Thank you so much. I've enjoyed it very much.
And with that, I just want to encourage everybody to visit apdaparkinson.org to register and to learn more about our next program, which is Ambiguous Loss, Understanding Uncertainty, on February 6th. And we are also excited to announce that registration is open for APDA's virtual Parkinson's conference on February 14th and 15th as well. Thank you so much for joining us today.
Hi, I'm Leslie Chambers, the President and CEO of the American Parkinson Disease Association. Each month across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.